guys know what time it is. That's right, our resident naturopathic doctor in the house, Dr. Julissa Hernandez. And tonight's conversation is all about toxic shock syndrome. Now, if you don't know what that is and what it's associated with, it's associated with tampons. You know, Dr. Julissa and I talked about this over the holiday break, different stories that we wanted to bring to you. And ironically enough, tonight's conversation is all about a story that Dr. Julissa came across. And to know what toxic shock syndrome is and how difficult it can be, also deadly, is something that we're going to speak on tonight. I do believe that Dr. Julissa is in the studio with us. Dr. Julissa, how are you this evening?
I am absolutely wonderful and divine. How are you, Kathy?
I am wonderful, feeling good. You know, here in North Carolina today, we had almost 60-degree weather. Can you believe that?
Oh, God bless you. Rub it in, why don't you? That's okay. All right, rub it in.
but that's okay, because Dr. Julissa, they're talking about snow in 2 days. I'm like, really?
Okay.
Come on now.
Oh, all right. Well, nature's going to hit us some way, somehow.
I know that's right. Well, tonight's conversation is going to be an interesting one. You know, we're going to be speaking on toxic shock syndrome. And, of course, we know that this is associated with tampon use. But before we do that, Dr. Julissa, you know that we have family members that join us every single week right here on Healthy Living. If you will, please, if you could take a moment just to introduce yourself to all the new family members and, of course, everyone that listens weekly here on Healthy Living, that would be great.
Great. Thank you so much, Kathy. It's an honor to be here once again with you and the Source Radio family. I'm Dr. Julissa Hernandez, naturopathic doctor and certified natural health professional, practicing now going on 21 years. I'm an international speaker, also on natural medicine, a teacher of natural medicine, writer of natural health articles, and also am a television and radio personality, most well known as the resident naturopathic doctor of the nationally syndicated radio show, The Michael Basin Show, for 9 years, and now honored after that platform to be a part of Source Radio Network. Kathy, thank you so much for having me.
Awesome. Thank you, Dr. Julissa. Well, you know, tonight's conversation is an interesting one. I know that you and I had the opportunity over the holiday break just to talk about various topics that we want to bring into the new year. And ironically enough, this particular topic is something that you came across, which is the toxic shock syndrome. I'm going to call it TSS because, as you can see, saying it as many times as I have, it doesn't sound correct. So I want to also share with Source Nation, you can follow us tonight. You can go to DrJulissa.com. The article that we're going to be speaking from is all about menstrual cramps, tampons, HPV risk, and more. And then, of course, the story that Dr. Julissa will share with us as well. We'll put that information on our Facebook pages. So, Dr. Julissa, talk to us about TSS. What is it and the cause of it?
Well, it's a bacterial infection that will develop in a woman if she is not releasing that toxic blood that she's supposed to release during her menstrual cycle. It's unfathomable to me the way a woman can think that a tampon can absorb all of that, or better yet, let's just think about a woman that, for example, is shedding, obviously, that uterine lining every month, because that's what a period is. You're shedding that uterine lining because you're not pregnant. And a woman tends to see clots, whether they're very tiny, whether they're large, whether it's a significant amount. The thing is, a tampon, Kathy, cannot absorb a blood clot. I need my ladies to really use the common sense. We have to allow our bodies to release that toxicity and those impurities every month. It is toxic blood that we are shedding. And if we're keeping that tampon in and you're not releasing those clots, they get reabsorbed by the body. And think of them as just sucking up into the internal organs, right back up again, just just being reabsorbed into the body, going back into the bloodstream, being accumulating on the uterine wall. And then I'm treating women with endometriosis and PCOS and fibrocystic breast and fibroids and all of that stuff that I have to treat female patients with day in, day out. They have to allow their body to release. I mean, I can't say it enough. And all my female patients can tell you over this 20-year stretch that is what I most definitely instigate that they must do, whether they want me to help them get pregnant or they want me to help them shrink fibroids. That's something that has to happen to eliminate tampon use.
Dr. Julissa, thank you so much for sharing that with us. I had the opportunity to just speak with a couple women today and shared our conversation with them in reference to what we're speaking on tonight. And my question was, if they were tampon users or if they wore the maxi pads, why would they choose, or what would you choose over the other? And the women that I spoke to all said, and I felt the same way too, that, wearing a tampon is more convenient, it's faster, and it's easier. Now, and we got a little bit deep, and I told them, I said, actually, I had to come away from tampons because I wasn't releasing a lot of blood during my menstrual, and it was uncomfortable to wear. So let's talk about that. And I'm sure you've probably seen patients in your practice where they've shared the same sentiments that at once upon a time they could wear them, and then all of a sudden they weren't able to wear them, and it was uncomfortable. What are your thoughts about that? And if you've heard it before, what are your suggestions?
Okay, well, the fact that they were once able to wear them, I'll say this. A lot of the argument that I get in the first 5 minutes, only the first 5 minutes, because I really make a case for them not to use it, is the following. Oh, Dr. Julissa, but I bleed so much. I bleed through my underwear. I bleed through my clothes. I mean, I had a severe, embarrassing accident at work, and then they tell me this whole story about how they left a pool of blood in the seat. And so, I'm getting a little blunt here, and you know that that's my style. So I hope that's okay.
That's okay.
Okay, so, I these are the stories I get in the oh, my God, I left a pool of blood in the seat, and when I stood up, it was the most embarrassing thing, and people don't look at me the same at work. Okay, fine. So you're bleeding excessively. Let's think about this for a moment. First of all, these regular tampons that are sold in regular drugstores, okay, are laced with chlorine. So are the regular, quote-unquote, maxi pads that one buys in regular drugstores and supermarkets. When I say regular, I mean not organic, not 100% cotton. So let me just make that clear. So you're using these tampons that are laced with chlorine, and these fumes are inside the vagina. They're inside the vaginal tract. These fumes, okay, are then going to cause a vaporous reaction that are going to affect the uterus and cause more cramping so that the uterus has contractions, and they will cause you to bleed more. Ergo, they sell more. So when I say that, they're sitting there now with their mouth open. Like, you're kidding me, Dr. Julissa. Oh, no, yes, that is absolutely true. Same thing with maxi pads, that are the regular, quote-unquote, maxi pads that are not organic, not 100% cotton organic, that are also laced with chlorine. All right, that cause that vaporous reaction, cause the uterus to have contractions, so you cramp more, and you also bleed more. Again, ergo, they sell more. So I've already proven it for 20 years, time and time again, that I try it. I can't help you. I can't help you shrink your fibroids if you're going to keep using tampons. I can't help you get pregnant if you're going to keep using tampons. I mean, I'm that blunt with them. And thing is that they then are subjected and pushed up against the wall where, okay, I'm going to try this, Dr. Julissa. And they give it a month, give it 2 months for your body to kind of regulate it. You're going to most likely see clots because the body is going to be shedding some of that waste that was kept in there month per month. And I just need ladies to also think, So you've been using tampons for 15 years, and every single month you have clots. And every single year for 15 years, every single month for 15 years, something stays inside you and something stays in there. And clots still stay up there because we didn't release them. They got reabsorbed by your body. And you're wondering why you're in my office having endometriosis and severe pain. And you're wondering why you're in my office having uterine fibroids that are the size of a 3-month fetus, where you look as though you're pregnant and you're only 33 years old. I need women to really open up. And I had my staff put that this tonight's show is not just for women. Men should be listening to this too, because they have women in their lives that they love and daughters in their lives that they love. And we're referencing that article of that little girl that died at 13 years of age, a swimmer, and a lot of the issues of athlete women wearing tampons is that you see this, and those parents are suffering because their child was using something that, quote unquote, society feels is a normal, so convenient thing. Don't go swimming those days. You know, ladies, don't wear the white pants. Don't wear the white skirt. If it's your wedding day, you're going to have to put on a lot of layers of boy shorts and a lot of pads so that you feel, I mean, let's be real. I give them options. Okay, sexy all the time. I get it. Go and get yourself 3 pairs of black lace boy shorts that you only use when you have your period, and use the pads, use the wings. Okay, do that. I mean, I make it so they're comfortable, and I tell them why they must do it. So.
Yeah, good information. I want to go to the article, if I may, in regards to the teenager, the swimmer that was 13, and it says, here in the article, dies from TSS caused by a tampon after doctors mistook her vomiting for a stomach bug. Now, it said that she basically was suffering with sickness and diarrhea, and she was diagnosed to have like a stomach virus. Then her mother stated that she deteriorated and died a week later after suffering a bleed on the brain. Now, for those that are tuning in right now and trying to get a full understanding of TSS, what are some of the symptoms?
Some of the symptoms are exactly those. Okay.
Go ahead.
Yes. It's a severe infection that is going to cause all types of symptoms, from tremors to severe high fevers to nausea and vomiting. And symptom that the young lady had there, for example, diarrhea, extreme fatigue as well, because, again, the body is being poisoned is what I need these ladies to understand. You're keeping toxic blood in you. You are keeping poison in your body when you're wearing those. And for those that keep it in for, 30 minutes, an hour, even though they're doing so, and I know there are organic tampons out there, what really would be a reason that you would need to wear it for that amount of time? If you know that there are the options of maxi pads, you would know, but just consider the negative effects later, okay? So we're looking at those types of symptoms, the nausea, vomiting, and so on. You're going to have problems breathing as well because, again, it's a poison. So a person can hyperventilate they can hyperventilate when they're dealing with this sort of a shock. The lungs feel constricted. Those are other symptoms. And apart from that, just let's say you're the woman that, but I'm consistent. This is the other argument I get, Kathy. I'm sure you've heard this. But I take it out every hour. Okay, that's one I've heard. Dr. Julissa, I'm good with that. I take it out every hour, and when I'm going to get blunt again here, so I know that adults are listening. I take it out every hour. This is what I've heard in my office, and when I take it out, the clots come out, and they just, they just come out when I'm in the bathroom, and I feel that I can still wear them. I'm good. I'm going to do it every hour. You're still keeping poisonous blood clogged up in you. I don't want to hear it. If it's something that you're doing on a constant basis, you've been doing this for years, you're putting yourself at risk of not just TSS, but also HPV. And how
many women out there don't have human papillomavirus to the point where they're then developing genital warts. They're having extreme pain during sexual intercourse. The cervix becomes very tender and bruised and scarred also, even from tampons. I want to just back up, if I may, Kathy, to the question, and forgive me, the question that you had regarding women being able to wear them and then later on not being able to wear them and feeling discomfort. Okay, I'll tell you why. First of all, your anatomy changes as we age. I mean, it just is what it is. It's right. So the vaginal canal is not necessarily, for example, the same. Women has had children and so on. There could be some slight prolapse there of the uterus, bladder, and so on that could be causing that discomfort. But another thing that I want women to understand is that every time you bring in a tampon, you're scraping your vaginal walls. Okay? I don't care how soft you feel it is in your fingers. The mucous membranes of the vaginal wall are very tender, okay? So you're scraping your vaginal wall each and every time you're bringing it in and pulling it out, bringing it in and pulling it out. So that in itself may cause some slight scarring of the vaginal tract to the point where even when your male partner or if you're utilizing sex toys and so on, you may feel discomfort later on when they're entering you, and you feel, I've had patients describe it in my office like a scraping effect. I feel like he's scraping me when he's entering me, Dr. Julissa. That's something I've heard from years back. So that's why the body will start to kind of push it away and not be able to handle it any longer, if that answers your question, okay?
Yes, it does. Yes, it does. It gives more insight into that, and definitely when I am around them tomorrow, I will share what I've learned tonight. You know, I want to go back for a second, if I may, in reference to the HPV. Now, in the article, you basically stated that the use of tampons is a strong predictor of high-risk HPV persistence. Talk to us a little bit more about HPV and the correlation with all of the tampon use.
Well, you're more susceptible to that sort of an infection. A woman who wears sanitary napkins is 5 times more likely to clear their high-risk HPV problem, and a woman that wears tampons is 5 times more likely to develop HPV. Now, human papillomavirus, known as AKA genital warts. Let me explain something. Men are carriers, but they have no symptoms. Okay? Men can be carriers and they have no symptoms. If a woman's immune system is high, if she takes care of her body, if she is truly healthy and truly working on maintaining a balance within her, whether she has intercourse with a man with that issue, her body can fight off infections. HPV is an infection, okay? But if you are a tampon user, I just mentioned that the tampon scrapes the vaginal wall. So just think about open skin. Think of that. Think of scrapes on your skin externally, right? And then you're exposing yourself to some infections. It's going to penetrate much quicker. You're more susceptible to that infection, that viral problem. If there's a tenderness and open membrane, if there's a healed, strong vaginal tract that has no scarring, that has no scrapes, then you're not going to be so susceptible to a sort of an infection like that and other STD infections like most women that use them are. Okay?
Good information. Source Nation, we are speaking with our resident naturopathic doctor, Dr. Julissa Hernandez, and tonight's conversation is all about TSS. And we've been discussing symptoms as well as discovery when wearing tampons. Dr. Julissa, we actually have a question that has come in. I think you may have given us some great information on this, but I want to go ahead and ask it, and if there's anything that we can possibly add to this young lady, this would be great. And it reads, what are the symptoms, the beginning symptoms of having toxic?
Well, that's what I mentioned, for example, a moment before. Keep in mind that this is poison, toxic blood that you're keeping in your body. So symptoms can range from, as I mentioned a moment ago, fever to chills to tremors to nausea and vomiting. Okay, they may have the woman, as I mentioned a moment before, they may feel some constricted breathing as well. The lungs do become affected. Again, it's a poison. Think of how a body would react to poison. Okay, dizziness, extreme fatigue as well, and it can be a range of all those issues. Just symptoms of a poisoned body. Those are what a woman is going to experience. I would say don't wait to feel those sorts of symptoms. There's enough awareness for women to understand that this is not something that we should be doing. The nature of what our body does every month is to shed that uterine lining, to shed and let it expel itself from the body. That's why I so much recommend the organic maxi pads, okay, for women to utilize at that time. And I've proved it again, time and time again. I promise you, you will notice less bleeding. If you're a heavy bleeder and that's your argument, I promise you that you will notice less bleeding when you utilize organic maxi pads.
Great information. Now, I want to stay right there for a moment and discuss the organic pads. Now, talk to us a little bit about that and the difference between the pads that you're buying at your local drugstore. I know that you were saying that the ones at the local drugstore are filled with chlorine, but can you share with the listeners tonight, our family members, about the organic products?
Okay. Well, the organic pads are much times made from 100% cotton, and you can find them at your local natural health food market, natural health food store. They carry them. I know that some beauty supply places also tend to carry them. If you don't have places like that near you, I know that they're available online. There are various different brands, so I don't promote a specific brand. I just tell my patients, get organic maxi pads. But again, what the regular ones have is the problem of being laced with chlorine, and those fumes and that vaporous reaction in that damp, dark area is going to go up through the vaginal tract, and it's going to affect the uterus to the point where a woman starts feeling contractions practically, and that's the cramping. And, of course, it stimulates her to bleed more. Again, ergo, they get to sell more maxi pads. So that's why I recommend going the other route to looking for a more natural sort of pad. The organic ones are a much better choice. And they'll feel the changes after about a month to 2 months of using them. I just say, I promise you'll love me in 2 months. That's all I tell my female patients. Look, I promise you'll love me in 2 months.
Love it. We have another question that has come in, a very good question, and I would like this young lady also. She basically stated that she's been wearing tampons since the age of 15, and she is now 40. She says that she does not wear the regular or the medium tampons. Now that she's older, she's just spotting, so she wears like the light day. But she wanted to know, Dr. Julissa, even now that she doesn't have a full 7-day cycle, it is now to either 2 to 3 days, and she chooses to wear the light day, she still has some form of cramping. Does that mean that she could possibly have symptoms of toxic shock syndrome?
If she experiences the cramping and other severe discomfort, specifically when she has the tampon on, absolutely. Again, let me explain something. It's not normal for a woman to have menstrual cramps. I hope that women know that. It's not normal at all. Okay? And my family, my mother can be a testimony that I have never suffered from menstrual cramps. Only the day I was going to give birth to my son. That's the one day I ever felt menstrual cramps in my life. My sisters can be testimony to that to you as well. I'm telling you that it is not a normal thing. You just shouldn't wear them. You're keeping, dirty blood inside of your body. It's going to get reabsorbed. And then women also ask themselves, why their skin, let's say, is not healthy, why their hair, for example, is suffering. If the blood, what nourishes your organs throughout your body, has swimming in it toxicity to this level, then ask yourself, how is your body not going to suffer in other areas? Okay, so it's a chain reaction that accumulates over time. Yes, you can correct this issue. Stop using them, use more maxi pads, and then I recommend wonderful blood cleansing supplements that help with that as well when I see that a woman is very toxic in that sense. So.
And I was just going to add to what the young lady stated, my thoughts and opinions on that. That was the main reason why I stopped wearing the tampons, because I would cramp, but I would go a little bit further. Mine felt like they were labor cramps, and I'm not talking from the stomach. I'm talking about inside of my vagina.
Pelvic,
and I did not, the pelvic area, and that was very painful for me. So that was the whole reason why I decided not to wear that. And I would look into the organic pads, because that's very interesting too, Dr. Julissa. You know, with that being said, I want to go back to the article of the teen swimmer that passed away based on the TSS. Now, to me, I think that is very young for a young lady to even think about wearing tampons. I don't know if that suggestion maybe would have come from a coach, or maybe that's what her mother felt like she could use because of maybe her mother did. What are your thoughts about that? When you're bringing in young ladies into your office, or women that have young girls, and they talk to you about that, share with us some of the conversation.
I recommend they not use it at all. And of course, I've only had one teenager that was kind of refusing that, but I needed to explain to her the reason why. Now, the young lady that passed away, 13 years old, was a swimmer. It's an issue that you will find among a lot of teenage girls that are athletes, okay? From basketball players, I would say, to swimming, or being runners, jumpers, and so on. So, yes, you're going to see that sort of an issue and that clash with them when to perform, and they're thinking, oh, my God, I have my period. I can't do this if I don't wear a tampon. There's no way I can bleed all over the place. I mean, it's detrimental to their health. And it doesn't matter how soon you take it off. I mean, unless you were changing every 15 minutes, I don't even recommend that. You're keeping toxic blood in you. You have to talk to your daughters, explain to them this, show them the article. I mean, 13 is young. I wouldn't say just young because she's 13. They shouldn't be using them, period. Whether she was a virgin or not, if that's what we're trying to get to. But no, it just shouldn't be used. And there are ways to go about it. I've helped my female patients go about it where they don't have to have those horrible accidents that, for example, maybe they used to have in the past, that they felt forced to have to use tampons. I tell them how to go about it. There's ways of doing that. Okay.
Good information. Well, I tell you, tonight we've talked about a lot of things. We talked about the menstrual cramps. We talked about HPV, and then, of course, TSS. Dr. Julissa, as we are wrapping up, I love to either leave with an encouraging word or possibly some information that we have not shared in tonight's conversation. If you wish to do so, I would love for you to leave us with some parting words.
Well, please do look at the article that I've written regarding tampons and HPV risk. Follow me on Facebook. It's been posted there, on Instagram, and so on, so that you can get more detailed information on why it's a necessity. I also put there a link of an article that also discusses further the risks of HPV regarding tampon use as well. But we also know we're discussing tonight about toxic shock syndrome. My last parting words, really use, ladies, common sense when it comes to the health of our bodies. Our bodies are so delicate, Kathy, so delicate, and anything can just disrupt our hormonal balance and the other balances of our body. So really do think this through when you're considering that monthly time, all right? And don't put yourself at that risk, all right? Just let's think of our bodies more, love our bodies more, and not just look for always the convenient route when it comes to things. There's a lot of black skirts and black pants out there. So, and there are a lot of those, and that's what we need to do for a good 5 days or so when we're during that time. And there's ways to go about it. So thank you so much for having me tonight. I really do pray that this information that you and I have discussed and shared with your listeners has helped them and theirs to have a better life.
Oh, yes, most definitely. Again, thank you, Dr. Julissa, for coming in, and tonight's conversation was great. I've learned a lot, and I'm sure Source Nation has as well. Well, we look forward to having you back again next week with more great information and a dynamic conversation that we're going to have. Thanks again, Dr. Julissa.
Thank you, and I look forward to next week. Goodbye, Source Radio family. Good night, Kathy.
Good night.
Get at me for beats, yo.